Yeah.
So all of that.
So we're going to get to nutrition actually in a minute, but I've got another strength training one. So we've talked mostly about kind of our strength training so far. I also want to have you talk a little bit about how and why you recommend it for your patients. I know a lot of healthcare practitioners don't know much at all about strength training, and those that might have a little bit of knowledge kind of do think it's just for aesthetics, people that just want to like the glamour beach body, Instagram booty, or like whatever, right? But there's a lot of legitimate health benefits out there to it. So I'll turn it over to you and you can talk about that.
Absolutely. I joke with my patients, but it's actually in all seriousness that if I could write one prescription and give it to every single person who walks through my door, it would be to strength train their total body for 2 to 3 times per week, maybe 30 to 60 minutes for longevity, period. And some people look at me kind of laughingly and I'm like, no, I've actually printed it out several times off my computer and handed it to them. I really have. And, people might say it's about aesthetic goals, like you said, and it might be for some people, and that's great if that's what they're working on. But for the majority of my population in my practice, I am pushing them towards building some muscle tissue to prevent chronic disease that has riddled our country.
Yeah.
And 1 in 10 people in America has type 2 diabetes. We've got 30 million with type 2 diabetes, 300 million in this country.
Yeah.
And we've also got about, I can't remember the number, but about 80% of people who have prediabetes don't know it because we don't check A1Cs on a standard lab panel usually. It has to be kind of an add-on. So when we're thinking about metabolic illness in our country, insulin resistance, prediabetes, diabetes, heart disease, high blood pressure, high cholesterol, you name it, a lot of that goes back to the quality of our skeletal muscle and the inflammation that comes with extra adipose tissue, which is kind of a fancy word for fat tissue.
Right.
And we need to make muscle to burn fat tissue to bring down our inflammation load. So strength training is about doing that so that we can reduce our risk of dying early from things that we don't need to die from. And a lot of people don't connect that. They think about the food, but they don't think about the strength aspect, or they think about the cardio because, yes, that's great for your heart and great to bring your blood pressure down, but walking for 20 minutes isn't going to actually build enough skeletal muscle, to make a metabolic difference probably in maybe your some of those markers on your labs. And so the simple thing I'll tell my patients to give them a picture is that muscle on your body is like a sponge for extra glucose, an interchangeable term with blood sugar. So when we're trying to lose weight or trying to improve our metabolic health, the more strength we have, the more we're able to tolerate a glucose load or improve it for overall better wellness, in a fancy term. And then aside from the metabolic illness, it's about just longevity and being able to carry something when you're 80 and being able to pick a toddler or grandchild up off the floor and not throw your back out and live a good life.
Yeah. One interesting thing that you just said is that, a lot of people, one of their go-to forms of exercise is just walking, which certainly has some benefits, undeniable.
If you're walking, keep walking.
And it's also not enough to build any appreciable amount of muscle. And I think a lot of people out there have been misled or uninformed about what does it take to, when people like us talk about strength training, what do we really mean by that? Because I think there's a disconnect between what you mean and what I mean versus what a lot of people that have maybe only read fitness magazines at the counter at the grocery store or like whatever else. And generally I think our expectation would involve probably heavier weights than they think. So talk a little bit about that disconnect and why it's important to, not to knock on body pump again, but probably lift heavier weights than you would in a body pump.
I get it, yeah. And body pump, like I said, was, a great, I'm always going to applaud a patient who's coming into my office who is trying to exercise.
Yep, for sure.
I am never going to tell them they shouldn't do what they're doing. I might do it if it's risking injury, or I might adapt it if they're working towards this goal and I think there might be a better way for them to exercise. Right. But there is such a misconception about the load of weight we need to use to make actual adaptations to our muscle tissue.
Yes.
And high rep ranges of weightlifting in the 15, 20 beyond range, great. It might be great for some certain goals, but to actually build appreciable strength with muscle synthesis that needs to happen, it's more about a lot lower rep range, which means that people, especially some of your female clientele, need to appreciate that they need to lift more weight.
Yeah.
Pick up heavy things and put it down.
Right.
And don't dedicate 8 weeks of your life to it. Dedicate a year to your life to it to actually see the changes, because everyone wants to change in a month or two.
Right.
And then if they don't, they throw in the towel.
It's true.
And so we need to give it more of a long-term perspective, a heavier perspective,
Yeah.
a smaller rep range perspective, and reap the benefits.
Yeah, for sure. And we're the same way. We obviously applaud anybody that's getting out and doing some exercise. We also have seen so many people over the years that would tell me they would do classes like that. And they've done them for years, and they don't see any changes in their body.
I saw it all the time.
And I guess that is sort of who I'm talking to here. It's like, the work ethic is there, the discipline, the commitment. They're showing up 3 times a week, but they're not getting the changes. We've got to put you in a workout program that involves actually lifting heavier weights than those classes are going to do.
And it hindered my goals, too. For me, with teaching body pump, I stopped. One of the reasons was because of my mouth injury, and I couldn't enunciate well into a microphone for a while. But I was doing these 900 repetition classes on Saturday, and I'd get to Monday, and my workout sucked because I was struggling to recover, and I was like, all right, I got to can one of these.
And you've thrown that number out, like 900 repetitions in a workout. A lot of my workouts are a tenth of that, right? Like it's much heavier weights for much lower repetitions, and lifting weights that are heavy enough that you can't just do it for an hour straight, right? Like you do your set of 1 to 3 to 5 to maybe 10 reps, and then you need several minutes of break before you can go again. And that's a novel concept, I think, to a lot of people, but we want to make it a little bit more accessible, create some knowledge around it, and hopefully get some people out there lifting a little bit more. So.